Okay. It's 5 o'clock. I'll call the special board meeting, excuse me, for August 19th to order. And just before we get started, I would like to just remind everybody we're here tonight to be able to listen to concerns and issues from very many people and very many sides, different opinions. The one thing I would ask of you to remember is that we all need to be respectful. We need to be quiet when others are speaking. We need not to have a disturbance because we're all here also to hear everyone's opinion. So we need to hear all of the issues, all of the concerns. So thank you for that. And at this point, our opening prayer tonight will be by Mr. Stewart.
Everybody will pray. Heavenly Father, I love you. I thank you for your grace that allows me to serve on the Baldwin County Board of Education and to serve alongside the other men and women that are represented here tonight. Father, I ask for a special prayer of protection around Superintendent Tyler, the executive staff, the employees, the principals, the teachers, the students, and all the families that make up Baldwin County Schools. Father, I ask for a special prayer tonight for our country, Father. I just pray, Father, that you destroy this virus at its very root, Father. And I ask that those that have been affected, those that have lost loved ones, those that are sick tonight, Father, give them peace. Watch over them. And be with us tonight, Father. I ask that you bless those in the crowd. I bless those that speak. And at the end of the night, Father, it's not what I want that's important. It's that your will be done. And I pray this in Jesus' name. Amen.
Amen. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So we have no amendments or anything to this special agenda that we have here, correct?
No, ma'am, Ms. Dawson.
At this time, I entertain a motion to approve the agenda as is.
Motion to approve.
Second.
I have a motion and a second to approve the agenda. All those in favor, please say aye.
Aye.
Any opposed? And moving on to items of business.
Yes, ma'am, Ms. Dawson.
All right.
I want to thank everybody. I have an opening statement that I'll make to everyone, and then we'll get started. I've written this down so I didn't forget anything. I want to welcome and thank everyone for coming. We made a decision to open our public schools in Baldwin County without delay on August the 11th. We implemented many of the protocols we had in place last year in hopes of keeping our schools safe and remaining open. Wearing masks was not on our initial back-to-school list, but after further consultation from the medical community, as the COVID virus began to spread more rapidly in late July, we implemented a mandatory mask requirement. We have heard from parents who don't agree with this and also those who do agree. We have also heard from parents who think we should have delayed the start of school or should close schools today as a result of the virus. Today is an opportunity for the public to share publicly with the board their thoughts on this. We will work in this format. I want to present to you why we did what we did, the advice we have been given, and the medical reasons. First, I will ask a team from USA Children's and Women's Hospital to speak about the current state of affairs as to why we made our decision. USA Health has partnered with us on our nursing and COVID response and has been fantastic in how they have helped us. This includes a partnership to vaccinate our teachers and provide testing where needed. Second, I have extended an opportunity to the opposition group with common sense to present a speaker in opposition to masks. This is retired Lieutenant Demetrius Cox. Third, I've asked Dr. Sharp, a medical doctor from right here in Baldwin County, to speak with us. Dr. Sharp has been a medical advisor to us for many years, from communicable diseases to AED devices and emergency response. Following these speakers from our agenda, Madam President, I will turn the room over to you for comments from the public. We have 30 speakers who have signed in, 15 on each side, representing those who support our decisions or think we should be doing more, and 15 who are opposed to the decision we have made. Before I introduce our first speakers, let me speak a little about where we are and why I've made a decision which was made. My reasoning is simple. I don't want to close schools. I think keeping our schools open is critical for our families and our community. When we started our opening at the beginning of July, at the end of July, we saw dramatic absences from COVID among our employees. I was very concerned about being able to staff our buildings because if we lose a significant amount of staff, we would need to close, and that would be devastating. Whether you think masks work or don't work, understand that requiring masks is a step in an abundance of caution, an effort, if you will, to keep our schools open. I'm sure you are going to hear many opinions tonight about whether masks work or not. If they provide a 1% reduction, I think it is helpful. I believe it is more than that. I think our efforts last year showed that wearing masks, combined with a strict sanitation schedule, washing hands, spacing out, worked. It protected our employees, and we were able to keep our schools open for the entire school year, unlike so many other school systems across the state and nation. My ears are open and our board is listening too. Tonight is a night to hear what each of us think. I do not expect that we all agree, but I hope that tonight we can listen to and respect each other. I hope that we can do this without embarrassing ourselves. I'm very Baldwin proud. I love this community, so I ask you to please be respectful. Share your opinions and your facts and allow your message to influence future decisions of the board as opposed to the name-calling and shameful behavior we have seen displayed on the national stage. With that, I would like to introduce Dr. Grims and his team from Children and Women's Hospital.
And as you move to the podium, if I might have 1 minute, I see a young lady sort of in the second to the last row with no mask on. Ma'am, please could you, thank you very much.
Thank you for allowing us to be here this evening. I'm Dr. David Grims. I'm a Baldwin County resident, live in Spanish Fort, and I'm a chair of pediatrics at the University of South Alabama and work at USA Children's and Women's Hospital. We appreciate the opportunity to address you tonight. I also have with me is Dr. Heidi Custodio. She is also a Baldwin County resident, and she's board certified in pediatric infectious disease. And she teaches our medical students and pediatric residents on infectious disease. And also Natalie Fox, who was instrumental in setting up the making availability of vaccines for Baldwin County teachers. And so appreciate being here tonight. One of the points I wanted to make, when I was growing up, you know, the cars did not have seat belts. And of course, we all survived that era. We would drive and even without a seatbelt, usually would make it safely where we were going to want to go. But I wouldn't think about driving my grandchildren anywhere today without buckling them up first. And because we know what can happen if you're in a motor vehicle accident not wearing a seatbelt, how bad it could be. And a lot of times you're in a wreck and you may be fine, you may be shaken up, but not need to go into the hospital. And without a seatbelt, you may be have to be hospitalized or in critically ill in intensive care. I kind of look at masks the same way. The mask by itself is not going to guarantee you wouldn't get infected with COVID-19. But as a community, if the children in the schools wear the mask and reduce the chances of spreading it, there's fewer children that will get infected overall. And because we are seeing more children infected nowadays. Today at Children's and Women's Hospital, we've got 20 children in the hospital sick with COVID-19, 7 in intensive care, 3 are on a ventilator. And, you know, this is more cases than we saw in 2020. This current strain of the virus is affecting children more than the strain of the virus is circulating in 2020. And in fact, in the past 6 weeks, we have admitted more children to the hospital in these past 6 weeks as we did the entire previous 11 months. So this strain of the virus tends to put children a little bit more at risk. So the thing about the mask is that when I'm at work, I wear a mask every day, and don't do it as much just for my own safety. I mean, I'm vaccinated, and I'm not. I know I'm careful in terms of hand washing and the infection control procedures that we take care of in the hospital and clinic. But I would worry myself if I contracted the virus from a patient. Most of my patients aren't vaccinated because they're children. They're not eligible for the vaccine. And yet every week I'll have children that test positive for the virus. So I would feel badly if I contracted the virus, even if I wasn't sick from it, and transmitted it to somebody else that was not vaccinated. And I think the same thing can be said of children. There's a lot of children in Baldwin County that even if they've got some chronic medical conditions, asthma or other conditions like that, where the parents want them to be in school to receive the benefit of the Baldwin County education. That's why a lot of families locate here. And I would feel badly if we had children that inadvertently, maybe not sick from the virus, transmitted the virus to a child who wanted to be in school that had a medical condition that made them more susceptible to be sick. So just thinking about it, you could take your child to school without buckling them in. I wouldn't want to take that chance, and I kind of feel the same way about wearing the mask. I think it just reduces our risk. So I'll turn it over next to Dr. Custodio.
Thank you, Dr. Grams. I hope you can hear me clearly. All right, thank you. And thanks all for inviting us and for spending the time to hear what we have to say. As Dr. Grams mentioned, I'm a pediatric infectious disease physician, and I do take care of children with COVID in the hospital. I was on service or on call for the hospital for the past few weeks until recently. And I can tell you that there's nothing more difficult every time I go in the room when I see a child with a tube down their throat, hooked up to a ventilator, with a mother or father looking at their child, wondering what else they can do to help their child. It's not very easy dealing with that every day. And unfortunately, that's a scenario that's becoming more and more familiar to us in the hospital, as well as to some parents here in our community. And this is the reason why I am here to ask for your help, to help protect our children from being admitted to the hospital, from getting sick. This, I think, is the worst that we've ever had for children in this entire pandemic. This Delta variant, in my opinion, is a game changer. This is the worst that we've seen in terms of how it has affected our children. And just like what Dr. Grams mentioned, the numbers have significantly changed. For example, from March of last year, 2020, to March of 2021, about 500 kids infected with COVID passed through our hospital. In the first week of August alone this year, we had 125. So 500 in 1 year, 125 in 1 week. That's how stark the numbers are. And it's not just the numbers, it's the severity of the illness for our kids. And like what Dr. Graham said, this past few weeks, our PICU has been full, and the numbers are 1/3 to 1/2 of our PICU are filled with children with COVID. It's difficult to see when a 2-week-old is admitted to the hospital having difficulty breathing from COVID. It's difficult to see when you have a 2-month-old admitted in the hospital with a tube down their throat. In our state, we only have 3 ICUs, here in Mobile, Birmingham, and Huntsville. We're all seeing the same things, a lot of kids being admitted. My fear and the fear of many healthcare workers is that we're going to run out of ICU beds, and we won't have a place to take care of our children. The surrounding areas, surrounding hospitals around us are battling the same issue. Where would we send our kids? And again, this is the reason why I'm here. If I were asked, and I would look at you, tell you like you are my family, 3 things that we can do to help protect ourselves, your child, and the child of another person, 3 things. 1, if your child doesn't feel well, please have them tested for COVID. Work with your pediatrician to let you know what to do and when can they safely go back to school. Doing this may help protect another child. They don't spread the infection to another child. Number 2, vaccination. Children 12 and above are now eligible, have been eligible since May to get vaccinated. If you haven't done so, please do so. Vaccines are safe, vaccines are effective. The risk, the probability of getting any serious risk or side effect from the vaccine is very, very, very low compared to the probability that we have now that a child will get COVID and suffer its complications. The recent patients that I took care of in the hospital have all not been vaccinated, even when they were eligible. The parents, the immediate family members, were also not vaccinated. By choosing not to get vaccinated, we have a child that is vulnerable and no surrounding protection around that child. Number 3 is masking. I know there were a lot of controversies last year when there were questions about do masks work or not. We're not in 2020 anymore. We are 15, 18 months later. We have more studies to support that masks do work. Now, you might ask, a virus is so small, how can a cloth mask work? The thing to remember about viruses, they are not floating on their own. The way we transmit COVID is through respiratory droplets. So respiratory droplets are small mists of water, protein, mucus. All of us, as we breathe and talk right now, is spewing out respiratory droplets. The virus is attached to those respiratory droplets. Those respiratory droplets are big enough that most of them will be blocked by a cloth mask. There are a lot of studies that have been done in real time, especially when we were back in school last year. All those studies show that masks significantly reduce the chance of another child getting COVID from another child when all the children are wearing masks. This has been shown by multiple studies by big trusted names in medical field. So again, just to sort of reiterate, these are things that I advise my family: masking, vaccination. All of my family members have been vaccinated. All of my family know that they need to wear a mask. And on behalf of the staff at the hospital, from nurses, doctors, laboratory technicians, from even behind the scenes, the clerks, janitors, the administrators, we are all asking for your help so that we can protect the children in our community. Thank you for your time.
Thank you, Dr. Custodio. My name is Natalie Fox. I'm Assistant Administrator and Chief Nursing Officer for USA Health's Physician Group Practices. I'm also a pediatric nurse practitioner who has practiced in our community for 10 years. I have been on the front lines of the COVID pandemic back since March 2020, when quickly we needed to get together a plan to provide testing. And I myself, with another colleague, went to the parking lots to be able to test our first patients in early March. And lo and behold, all we had to wear were masks. And that was a scary time. You know, everything was on the news at the time, and I have children myself that I was wanting to protect. But we had worked in healthcare. I had worked with kids that typically got communicable diseases, and every day when we would go see them in the clinics, we would put on, if we thought they had flu or RSV, I would put on a mask, because that was also something I did not want to bring home to my family. As of today, USA Health has tested thousands and thousands of patients. We have also been on the forefront of the COVID vaccine distribution for our community. And as you heard, we work to bring vaccines to the teachers of Baldwin County. As of today, we've provided over 85,000 vaccines to members of our community, and we continually to tirelessly work to be able to get those vaccines into the arms of those people who need them. And that includes anybody over 12 and up. I have a 2-year-old and a 10-year-old, and I will be one of the first in line when my children are also eligible. I get that question a lot. Would you give it to your own kids? And my answer is absolutely yes, and I wish I could give it to them today. Because what I'm seeing in our Children's and Women's Hospital, it scares me. You've heard from my colleagues, and not only is COVID there, but it's also everything else when we have the limited ICU beds. The possibility of an injury or an accident, or even something as simple as appendicitis. You know, I want to make sure that there's a room for my child there too, if I should need them. And I know that we have a lot of opposing opinions in the room, but I do believe that one thing is true, and that we all want the best thing for our children, correct? And so I think that Dr. Custodio said it well when she said we do have several things at our defense, which are socially distancing, and the reason for that is so we don't spread the disease to each other, masking, and the vaccine. One thing specifically about the vaccine with children is in adolescence is, does it cause infertility? And that was one thing specifically I got asked to talk about today, and I can tell you that I answer that question about 10 times a day. And the answer is that we have no scientific evidence that the vaccine causes infertility. Another question that I get is, can the vaccine cause myocarditis in my child? And my response to that is the risk of myocarditis when the adolescent patient gets the vaccine is 1.8 per 100,000. Not very good at math standing up here, but I'll let you take that into a percentage. But what I can tell you is that your risk of your child getting myocarditis if they get COVID is around 7%. That's quite a big difference. And typically we have seen viruses affect the very young and the very old, but one thing that we're seeing is a lot of adolescents hospitalized with COVID and getting something called multi-inflammatory syndrome in children that affects all their end organs, including their heart. Not only do we have to treat those children during that time, but there's the potential for long-term sequelae that could eventually affect their ability to play sports and require lifelong medications. So again, you know, we are here to tell you that what we're seeing. We're working in this every day. We wear a mask as we go to take care of patients to help protect us so we can protect our families. I commend the board for their decision to require masks. Thank you for having us here.
Dr. Grims, thank you for your staff, and thank you all for speaking through your medical advice. Right now, I want to introduce retired Lieutenant Demetrius Cox, who is here to speak as far as opposition on the mask. Lieutenant Cox.
Good evening, Mr. Tyler, members of the board, fellow constituents. My name is Demetrius Cox, a resident of Fairhope. I'm a retired lieutenant commander in the U.S. Navy, having served 10 years in the submarine force and the last 20 years as a special duty officer intelligence, including service with the U.S. Navy SEALs. One of my specialties is technical intelligence collection and analysis. Until 2014, I was Senior Intelligence Officer for China with Task Force 70 in Japan. I am a scientist and engineer by training and experience, holding bachelor's and master's degrees in science, including extensive research working with messenger RNA to develop genetic assays for detection of pathogens and viruses. I have 3 sons in Baldwin County schools. We are now 20 months into the global COVID health alert, which has been managed well in Alabama and right here on the Eastern Shore. Baldwin County has not been a hotspot of infection or death, and we should therefore focus on our successes and what the Baldwin County Board of Education has been doing right, especially pertaining to why compulsory masking of staff and students is not needed or required. First and foremost, on May 14th, 2021, Dr. Suzanne Judd, epidemiologist at UAB, announced the state of Alabama has reached herd immunity. That means at that time, at least 48% of Alabamians having contracted COVID, 1.2 million, which is now 3.74 million Alabamians vaccinated, and another 400,000 citizens having acquired partial immunity. Additional strong evidence against mask mandates arrives in the form of 60 days worth of data from April and May 2021 from Baldwin County Public Schools and other school districts statewide, where absenteeism and positive COVID test rates did not increase when the 2020 mask mandate was canceled in March 2021. These data offer important insights on the efficacy of the physical interventions of 1, vigorous hand washing with soap at least 10 times per day, and 2, cleaning school facilities with 1% chlorine solution plus other antivirals daily. They also provide excellent examples of proactive case management by your school administrators, where symptomatic staff and students were advised to remain quarantined with medical care until they recovered, tested negative for COVID, and returned to school. We strongly urge you to remember your successes and that for all the alarming media coverage and invective, US CDC confirms the current Delta variant of the SARS-CoV-2 virus strain also responds well to the many therapies and 3 COVID vaccines proven to have very high success against COVID. A review of CDC data, including reporting on Delta variant, conclusively show a continuing 99.9% plus survival rate for COVID patients, which is outstanding. Your COVID successes are confirmed by conclusive, overwhelming data from other places like Sweden, Ireland, Hong Kong, and North Carolina. You have each provided with information flyers published by the Swedish Crown, King Gustaf. You will please note the lack of any mask mandate in Sweden and their highly successful working model emphasizing personal responsibility such as self-quarantine, good hygiene, and social distancing. Some statistics out of Sweden: in a population of 10.2 million, they have had 174,000 infections or cases from January 2020 until today. In the 0 to 19 age group, only 14 deaths. COVID mortality in the 0 to 19 age group in Sweden is 0.0000014%. In Ireland, nearly identical across population of 5 million, but they stopped reporting all but top-line data in May 2021, which should tell us all we need to know about where Ireland is in this, which is on the road to recovery. In North Carolina, a recent study of over 90,000 students, plus thousands of staff and educators, as outlined by Zimmerman et al. 2020, health department staff determined only 32 infections were required within schools and 0 cases of a child-to-adult transmission of COVID were reported statewide. Most conclusively, Baldwin County statistics as of 1:30 this afternoon, in a population of 203,709, we've had 355 deaths since last January of 2020. This year we've had 169, and the Alabama Department of Public Health mortality rate for Baldwin County is 1.97%. The COVID mortality rate for all age groups in Baldwin County is 0.0008%. The mortality rate in the 17 and under age group is 0%. The COVID survival rate, which we've not heard an awful lot about that from the hospitals or anyone else, is 99.999%. Clearly, Baldwin County is not in a public health crisis over COVID. A child is more likely to be struck by a falling rock from outer space than to die from COVID or even to be hospitalized. Please do not be fooled by politicized infection or transmission curves currently in vogue. High transmission does not equal higher lethality, as evidenced by the common cold and the seasonal flu. Mr. Tyler, we read all of your correspondence, every word. In announcing a return to the mask mandate, you offered only anecdotes about the COVID Delta variant making more children sick. You wrote, and I quote, "I have also been advised that among children, death is not the only concern. Children are suffering from blood clots and inflammation, known as myocarditis, from the COVID infection. Both of these can be very dangerous and lethal for otherwise healthy children, even after fully recovering from COVID. This is not just speculation. This has been evidenced in recent deaths of children from our area," end quote. Facts. The CDC reports from January 1st until today, not one single child has died of COVID in the state of Alabama. Not one.
Please hold your applause and everything until the end. We have a lot of speakers to go through. We want to hear everyone.
Furthermore, as reported last month, a team of Johns Hopkins researchers studying a group of 48,000 children under the age of 18 with COVID found 0 COVID deaths among healthy children. I repeat, after studying comprehensive data on thousands of children with COVID, the team found a mortality rate of 0 among children without a pre-existing medical condition. The CDC claims somewhere between 300 and 1,800 children under the age of 18 nationwide have died with a COVID diagnosis in their record. However, Dr. Macri at Johns Hopkins reports that the CDC, and I quote, "The CDC, which has 21,000 employees, hasn't researched each death to find out whether COVID caused it or if it involved a pre-existing medical condition. CDC data on COVID are continually revised downward, and CDC has no interest in pursuing scientific facts." With such institutional distrust with scientific data and discussion, Dr. Macri says the CDC is avoiding transparency and rigorous inquiry. He slammed the agency, saying CDC overcounts COVID hospitalizations and deaths, and this problem is systemic. Mr. Tyler, you also wrote, and I quote, "The chief medical officer at USA Health, Dr. Michael Chang, has advised us that this Delta variant seems to be more impactful on children as compared to the previous versions of COVID. Earlier this month, it was reported that 10 children were admitted to ICU in Mississippi while fighting this new strain of COVID. Dr. Chang informed me this week that the ICU at Children's and Women's Hospital has been at or near capacity. Other administrators have advised us of the same information on IC units across South Alabama's hospitals, and these experts believe this will continue," end quote. More facts. Mississippi is not Alabama, and certainly not Baldwin County. The pediatric intensive care unit at USA Health has only 20 beds, and that same PICU serves 20 feeder hospitals owned by USA Health in a large geographic area encompassing dozens of counties in south central Alabama and south central Mississippi, which distorts statistical reporting. Interestingly, CDC reports that for the week of July 31st, the rate of hospitalization with COVID for children ages 5 to 17 was 0.5 per million, totaling about 25 patients nationwide in a population of 350 million. Even more interesting, CDC acknowledged not all of those children were in the hospital for COVID. Hospitalizations for RSV, another highly contagious respiratory ailment common in children, are currently elevated nationwide. If we are to believe Dr. Chang and the CDC, as of late July, the PICU in Mississippi admitted and was treating 40% of the pediatric COVID cases nationwide. This is simply not credible, even if those data were extrapolated across 2 or 3 weeks in the month of July. Also, to be clear, this meeting is about masks and it's not about vaccinations. We do appreciate the comment on vaccinations, but this is not about vaccinations. This is about masking. Finally, at no point have taxpaying parents ceded our authority over our children's medical welfare in decisions to the state of Alabama, or to you as school superintendent, or to your attorneys. This includes our parental rights in choosing when, where, and how our children utilize any medical device, such as face mask. Led by the AMA, the American Medical Association, hospitals and doctors are making billions of dollars off of COVID. And it's time that we start taking a closer look at their motivations and the negative impact that it's having on the public and especially our children. Please ask yourselves who you're really doing this for, because the numbers don't lie, and we're obviously not doing this for the kids. Thank you for your time.
Lieutenant Cox, thank you for your service to our country. Appreciate that. Thank you for your comments, and it's nice to know that you read my messages. I appreciate that.
Everyone, sir.
Right now, Dr. Sharp.
I'm Dr. Doug Sharp. I
have been working as an emergency physician in Baldwin County for 12 years. Probably seen some of your families. I've been here a while, and I spend most of my time at Thomas Hospital. I do work at Mobile Infirmary, as well as the freestanding ERs in Malbus and Saraland as well. My group staffs all of those. I came today to really paint a picture for you what is happening in our medical community here in Baldwin County. A few weeks ago, we had a sudden and dramatic surge in number of COVID patients. And we got quickly overrun. There was about 4 weeks ago, we all of a sudden had no space anywhere. We had patients overrunning us. At one point, we had right at 200 patients in all 4 of our ERs in one time. And it took us by surprise, and everything had been going really well with COVID. It had pretty much gone. And everybody was fine out, back having some social life again. But we quickly got overrun. And when I say what overrun is we have number of beds and capabilities in these ERs. The Malbus freestanding ER is a 12-bed ER. There were 49 patients in there. And that we've come close to that a few times. When you start hitting 25, 30 patients there in a 12-bed ER, you're overrun. And the Thomas Hospital ER has been consistently housing inpatient people that are waiting for beds because there's no rooms in the hospital. The hospital itself went from about 5 COVID patients, maybe 10. We didn't have a lot during early July. And in the course of about 2 weeks, we started averaging around 90. Thomas is a 155-bed hospital. This morning we had 200 patients. There's no place to put them. The ICUs are always full of capacity, and the bigger issue is even before this surge started, we were already at capacity. And Baldwin County's growing. We don't have the hospitals that we need with the size and the rapid growth. And even if we broke ground tomorrow, it's going to be 2 years before anything changes on that front. But we had, and we've been averaging about 5 to 7 intubated patients sitting in the ER waiting for a bed because there's no ICU beds anywhere. There's no chance of transferring someone because every hospital in the region's in the same situation we're in. These ICU patients sit there until somebody upstairs either dies or gets out or clears out of the ICU. We've averaged about 1 or 2 deaths a day at Thomas. In the past, I think late July through now, we've had 45 deaths. I've seen them die. So if they're not dying on paper, I'm not sure who these people are dying, but they're dying. And 45 deaths in this is just up to now. 15 of them were over 70. The rest of them were under 70. These are not old, sick people. Those are COVID patients died. There's a lot of other patients died. Those are COVID patients. This virus variant is very different. These are people our age. And I've seen multiple people my age very sick and die. I've had to intubate more people my age in the last 2 weeks than probably the last 5 years. We just don't have that healthy population get this. And they're not all in perfect health. They're mildly obese. Some maybe have diabetes, but there are plenty perfectly healthy people who are very sick with this. And we're overrun. At one point, I had every single bed, this was probably last week, had every single bed in our ER filled with admitted patients, nowhere to go. We call them boarders. We're working out of the halls. If you've been to the ER recently, you probably had a chance you got seen in a hall bed or in a chair. We're taking care of people in the lobby. That's not good medicine. We're not providing good medicine for those who need it now. We're doing everything we can. Nursing shortages have been awful. We don't have staff. The nurses are overrun. They have worked very hard and they are tired. When this thing first started to resurge again, everybody just looked at each other and just felt this sinking feeling. Here we go again. Because we thought it was bad in the winter. This is twice as bad as it was in the winter. And we barely got over 50 inpatients, I think, a few times at Thomas. Might have hit 60. We've been running 85 to 90 these last several weeks. And the problem with COVID and the way this disease works is you get it and you either don't get sick or you get sick. And you can take all the medicines, and you're either going to progress or you don't. And there's certain risk factors, and the lab folks are still trying to figure out why this happens. And these people progress, and it's a slow progression. You get sick on day 8 is when the folks who are going to get sick start getting sicker, and that's when we see them, that second week. So there's a little lag from when they get it. And then they come in, and they're requiring oxygen. They can't breathe. Their chest x-ray looks terrible. And they end up requiring admission for oxygen. And I don't know the numbers. I'm not here to spout numbers. Some of them deteriorate and continue to worsen until they can't breathe. And they either die or go on a ventilator. We have so many in the hospital that we've even reached capacity. We've overstressed the oxygen systems in the hospital. We had to shuffle patients around to make sure our oxygen system didn't overload. And, that's bad, folks. And this is the current state that we're in. EMS times are slower. You've got normal people who are working adults sick in our hospital. Right now, this morning, our 10-bed medical ICU has 10 COVID patients on ventilators. The mean age is 57. None of them are vaccinated. A lot of them are normal folks. Okay, they're normal, healthy folks. These are not, constantly ill people. And some of you may have family that's there. I look in these people's faces and they're scared and they're going to get sick. And I know a lot of the ones I'm going to intubate, half of them are not going to survive. And the volume of people has overrun us. And that's what I came here to tell you today. Y'all can have the mask arguments and debates, but you need to understand that if you're not scared of COVID, you need to be scared of your hospital system collapsing, because right now I can't take care of your families the way we need to take care of your families. And I'm hoping it gets better. There's a lot of volume has over the last few days decreased. The COVID volume is still there. People are still coming in with COVID, but there's a lot of people not coming, which is a double-edged sword. Your parents are staying home with chest pain, and that's going to catch up to us. And, to say that children don't pass this to adults, I can tell you over the last several days, I've had 3 or 4 parents that tell me that's where they got it. Their kid picked it up at so-and-so's house. Their kid picked it up at church camp. And so to tell me that that doesn't happen, I'm just not there. But I'm here to tell you that we have a problem, and this is a crisis in Baldwin County. We have no beds for anybody. Come walk through the hospital. And nobody's lying to you. Okay? I don't like taking care of sick people in the halls. That's where we are right now. Mobile infirmary is even worse. We're already stressed to capacity before all this started. So, as far as what to do, school couldn't have started at a worse time. And yes, there's children who are already testing positive. I'm not here I don't have numbers. I'm not into that. I'm just here to paint you a picture as to what we do in the inpatient world. And a lot of the outpatient physicians don't even realize this, that this is a situation we've been in. Is it going to get better? Yes, I think it's going to get better, because I think this thing's going to peak. You follow the patterns in other places, and it's going to peak and it's going to go down. This was very rapid. This was a lot more rapid than the winter. So, all I ask is that you just help us a little bit. I mean, we're exhausted. The nurses are exhausted. Nurses are leaving the profession. We're bringing in temps from all over the country and Canada, trying to fill the positions. We're doing a little better this week because we stopped surgeries and we are able to shuffle some nurses from the other parts of the hospital that are not involved in their care because they held surgeries this week. So I'm not here to tell you anything other than what is actually happening. I applaud you for making the decision to put the mask on the kids. I personally would have liked to have held school for a week or two because of when this timing was. The timing could not have been worse. And if things continue this way, there's going to be, as a physician that works my entire career in the emergency room, your greatest fear is somebody dying in the lobby or dying in the waiting room because they're waiting to be seen. And I've been places where that's happened, and I don't want to see that or have that happen here.
Dr. Sharp, let me ask you a question. Is there any reason, you're speaking fact, right?
Sir?
You're speaking facts, right?
Yes.
Okay. And I know
this is what I'm seeing every day.
This is what you see and what you do, and I know facts were cited before you. So, you're speaking medical facts. I usually watch the crowd. I'm pretty good at sizing people up and looking out in the crowd. you know, it seems like some of the things that you mentioned, some people basically found that humorous. You know, and I believe you're a respected physician here in this community. So we just all got to understand that we have two sides of an argument, you know, but I think we need to be respectful that when a medical professional states facts, and you might not agree with it because you think your facts are more substantiated, I just think we need to be respectful of each other. That's what we need to do. Dr. Sharp, you have anything else you'd like to add?
No, I'm just, these,
No.
No.
I'm stating my observations. This is what I've been seeing. This is where I mean, that's all I can tell you is things that I'm doing and that we have been doing these last few weeks.
Well, I appreciate that. Thank you, Dr. Sharp.
All right. Okay. At this point, does the board have any questions, any member on the board before we go any further? All right. If not, put my eyes on, excuse me. At this point is the time for public comment. Before we get started, I'll give you a little bit of direction of how this will be handled. Again, I say please be respectful. I really believe the worst thing that can happen to all of us is that regardless of who might be speaking, we get to a point where there's something they're talking about that we really would like to hear. And, you know, if there's laughter or at an inappropriate time, applause or whatever, then we're not going to be able to hear it. And we need to hear everything. We want to hear everything. We want to hear from everyone. So with that having been said, let me read this real quickly to you for tonight. If you have signed up to speak, I will call your name at the appropriate time. You're asked to come to the podium. You'll be given a time limit of 2 minutes. We will not defer times to other speakers. You will see a PowerPoint timer that will be on that screen. It runs also behind me. And we'll, at the end of your 2 minutes, respectfully, please take your seat. At the beginning of your presentation, please state your name and let us also know if you're from Baldwin County or if you'd like what city, but we need to know you're a Baldwin County resident. You need to address your comments to the board. We need to hear what you have to say. You are asked to refrain from mentioning any names or any particular students or employees. You are asked to please be concise. Please try to refrain from redundancy, from thoughts of other speakers. The board please ask that all members of the audience show decorum so that everybody can hear everything and have an opportunity to clearly understand and then clearly participate in our discussion so that when we get to our discussion. And I hate to say this because I don't want to feel like I'm up here with some kind of, you know, ball bat, but I do want to say, please understand, I have pleaded with you from the beginning of this to where I am right now of what we need to do so that we can hear, so that we can understand everybody. We understand their differences of opinion. Please understand that. The board reserves the right to remove a speaker who causes a disturbance. The board also reserves the right to remove anyone in the audience who creates a disturbance so that the civil and peaceful flow and exchange of information can go on. I will also, in my sense of direction here, I'll be telling you that I will be going back and forth. We have 2 sign-up sheets. One bears the signatures of those that are here to oppose the idea of wearing masks to school and other COVID protocols. And then there is a sign-up sheet for those in support of that. So we will be going back and forth. Please understand, okay? With that being said, I don't think I have any other notes. I think we're ready to begin. Yes. Oh, yes, of course. If the physicians need to leave or anyone, thank you so much for coming, and thank you for sharing your experiences and information with us. We appreciate that. Okay, if there's no one else that needs to leave, our first speaker is opposed to COVID protocols, Mr. Ken Bradley.
I'd like to make one correction before I get started. I'm not opposed to COVID protocols. I'm opposed to the correlation of my son wearing a mask to things being bad at the ER. That's what I'm rising in opposition to, okay? All right, good evening. I'm Lieutenant Colonel Kenneth Bradley, retired. I'm a retired Army Lieutenant Colonel, and I'm a 1998 graduate of West Point with a degree in civil engineering. I have a master's in environmental engineering from Missouri in science and technology, so we're past the credentialism. I'm also a licensed professional engineer, which is relevant because environmental engineering deals with contaminant and pathogen transport in the environment. I've also trained and worked in contaminated environments and full protective equipment on a regular basis over 24 years of my career. Training and preparation takes days and weeks to be done appropriately. Your policy states for students and teachers to place anything, to including gaiters and bandanas, slopped over their face because it might do something. You can't quantify or analyze an effect when the prescription is simply anything. Also, the American Association of Ophthalmologists states that coronavirus can be acquired through your eyes just as easily as through the mouth or nose. I mean, do you wear eye protection, Dr. Sharp, at your hospital? I'm sure you do. But you do when you're in a certain environment, correct?
You need to please direct your comments to the board.
Okay. But the district has no policy for that. These masks are not a freebie that may do something. OSHA requires that even if you have a proper mask, there are annual training requirements for wear, and you must have a proper seal. Not following these procedures generates significant cross-contamination risk for students and teachers. These textile masks shed fibers. If you ever look at your lint trap, cloth is in a constant state of deterioration, and breathing in cotton, neoprene, and nylon fibers is a known industrial hazard. There are also dozens of studies of toxic dyes, heavy metals, and endocrine disruptors found in textiles. The Association of School Superintendents, which Mr. Tyler is a member of, has studied the efficacy of transmission prevention due to school mask policies since August of 2020 with real-time data. Their ongoing study of results demonstrate a higher transmission rate among students and teachers in schools where masks have been mandated. I know you're trying to make the situation better by doing something, but blanket inappropriate use of an inappropriate device can only increase risk. Thank you.
Thank you. Next, we have Dr. Ben Shrubby. Is that correct? Thank you.
All right. Thank you all for letting me speak tonight. I'm Ben Shrubby, family physician here in Baldwin County. Moved here in 1997 from Okinawa. I was a Navy physician supporting the Marines in the Far East. And I just want to say in my time, it's been a long 1.5 years, and I echo Dr. Sharp on that one. It's just been a long 1.5 years. I just want to echo that in my practice, and I'm going to give you the outpatient, busy clinic perspective. We see a lot of COVID patients. We're seeing more and more children every day with COVID. And I'll just tell you what I think works. I think 2 things work. I think vaccination works, and I think masks work. And I'm going to tell you our experience with masks. So when this all started about 1.5 years ago, we decided to do universal masking in our clinic. This means, universal masking means everybody wears a mask. The patients wear a mask, the staff wear a mask, the doctors wear a mask. And I can tell you, in 1.5 years, even before the vaccinations came out, we had, in our clinic, 0 cases of our staff contracting COVID from patients, other staff members, which I was amazed, and that's probably better than the average. I was just very amazed. Now, I will tell you, some of our employees got sick. They left the clinic. They let their guard down. They got in situations. They got sick, sometimes seriously ill. But in our clinic, that did not happen. You know, COVID's here. Everyone in this room knows somebody with COVID that's had COVID, that's had a bad outcome, that's even died from COVID. I mean, it's everywhere. We know that. Masking to me is an easy thing to do that works. You know, and I think as a parent, you know, I'm thinking, you know, if you get up in the morning, get your child ready to go to school, put their backpack on, and you're going to say, but you can't wear this to school. Mommy and Daddy love you, but, you know, we're trying to make a point here. So, you know, I'll take the seatbelt analogy. We've got to keep these kids buckled up. Thank you.
Thank you.
Madam President, may I ask a question?
I'm sorry?
May I ask a question?
You may, yes.
For Dr. Shrubby, I hate that I didn't catch you before you sat down. I'm sorry. But I did have a question, and really for any of the physicians or nurses in here, can you give us I understand that a mask is not the only preventative. You know, we need layers of protection. But can you explain how the mask works, how it prevents or helps lessen the potential exposure or the droplets or the spittle?
Yeah, I think Dr. Grimm's said that earlier, and I'll you know, I'll echo that. Is that, yeah? I mean, it's catching. You know, these things. Nothing in medicine's 100%, but these are catching. Or I think Dr. Custodio said this. I mean, a lot of these viruses are sitting on. I mean, you call for sneeze, that virus is in that mucus going out, is sitting in there, and that mask will catch a lot of that. Not 100%, but you know, you just don't want to get that heavy viral load that comes with somebody coughing straight into your face. And it really needs to be universal, and I think that's the key is I need to have my mask on, you need to have your mask on. That's double layer of protection. Any distance you can get between you and me, all the better, all the better. So that's kind of what we're looking for, is that double, you have it, I have it, and then that gives us a lot more protection of that virus coming through that mask than one of us having the mask on, or that, you know, and I always say, please keep it above your nose. It's more of a chin diaper once it gets below the nose, so that's another part. So does that answer your question?
Yes, thank you.
All right.
All right. The next speaker in opposition, Mr. Eric Whitlow, I'm sorry.
Good evening. I want to start by thanking our elected officials for serving this community. I want to thank you for the opportunity to speak and for listening. My name is Eric Whitlow. I'm a father of 5. I have 2 kids that are still in the Baldwin County public school system. I graduated with a degree in biology. I had a minor in chemistry, a minor in business ethics. I attended medical school. I currently work as a realtor and lead a team here in the Southeast. I also own a training facility here in Baldwin County in which I teach health and wellness. Mask mandates in school do not work. Our kids enjoy youth group activities at church. They practice at sporting events. They attend karate. They do neighborhood wiffle ball tournaments with friends, all of which are not wearing masks. But we send them to school for an 8-hour, very confined, controlled day and force them to wear masks. This doesn't pass the common sense test. Masks actually do more harm than they do good. Virus particles such as COVID-19 are between 60 and 140 nanometers in size. Surgical masks have pores in them that are 200 to 1,000 times that size. Bacteria, our mouth has more bacteria than any other part of our body, including our anus. And as we exhale, we're breathing out bacteria. The bacteria pores are 5 times that or the bacteria is 5 times the amount of the size of the pores in the mask. So our kids are breathing out and inhaling this bacteria all throughout the day. It's well known that COVID-19 deaths are greatly due to secondary bacterial infections, such as pneumonia. Therefore, wearing these masks increases the risk of such infections. Prolonged wearing of the mask decreases blood oxygen levels, it increases blood carbon dioxide levels, and puts the body in a more acidotic state. Lastly, our kids are not trained in how to properly wear masks. When I go through car line, I see them twirling them on their finger. It's under their nose, the diaper that you mentioned, it's under their chin. They're using them as a slingshot. They're constantly adjusting them, bringing more bacteria to their face. I would request that the board consider removing the mask mandate and leaving that decision up to the parents. Thank you.
Next, in support, Dr. Fagan.
Hello, I'm Dr. Karen Fagan. I'm a Baldwin County parent, and I'm also the Chief of Pulmonary and Critical Care Medicine for the adults at University Hospital in the USA Health System. I can't separate those two roles right now. I applaud the board and Mr. Tyler for putting the safety of our children, our staff, our educators, our whole community as a priority in trying to prevent the spread of COVID. I applaud you for that, and I hope that we continue to follow the science and continue to follow what's happening in our community that is very real. I do know that kids bring home COVID to their families. I take care of those adults who come to my hospital. And much like we heard earlier, we do not have any ICU beds. I have patients on ventilators in every nook and cranny I can find in the hospital. Those people acquired COVID from someone else. Our children bring things home with them, including COVID. I have seen families devastated in the last 2 weeks with COVID. I have pregnant women who are incredibly ill and may lose their life, if not the life of their child. I have multiple generations of the same family dying in our ICUs. Our children need to protect each other, their teachers, the staff in the schools, and they need to help protect all of the people in their lives, and wearing a mask is part of that protection. I cannot stress more the fact that this COVID is not the COVID of earlier. In fact, Alan Perkins, our chair of family medicine, recently wrote an editorial that we should change the name. This is not COVID-19. This is COVID-21. And COVID-21 is deadly. And I appreciate and support continuing the mask mandate as long as it is needed to protect my kids and my community. Thank you.
Thank you. The next speaker in opposition, Deborah, I'm sorry, I'm sure I will just butcher this, Ristano.
Oh, you did great.
Oh, well, thank you.
Yes, it's hooked on phonics. You just have to spell it out. That's all. Mercy. Thank you very much. You did great on my name, by the way. My name is Deborah Ristano. I'm a registered nurse. My primary background is in mental health. I've been working in and around the field of mental health now for over 20 years, and I have served all ages in a variety of mental health settings. Today, I would like to talk a little bit about what we've seen in the mental health field over the last year and a half as it relates to our children and our COVID policies. Last July, the CDC director, Robert Redfield, remarked, and I'm quoting, There's been another cost that we've seen, particularly in high schools, that we're seeing, sadly, far greater suicides now than we are deaths from COVID. We are also seeing far greater deaths from drug overdoses, end quote. The completed national suicide data from 2020 will not be available until 2022, but I can give you some preliminary numbers that we know now. Suicide attempts by girls as of the beginning of the year has increased by 51%. For boys, it has increased 4% as compared to the same time frame in 2019. Right now, the CDC reports that the rate of suicide for children between the ages of 5 and 13 has risen to 1 every 3.4 days. There's been a 334% increase in intentional self-harm claims among 13 to 18-year-olds. And the CDC is acknowledging a 31% increase in ER visits related to mental health for ages 12 to 17 between March and October of 2020 as compared to the previous year. The American Academy of Pediatrics is also reporting that about 90% of the children who actually complete suicide have serious mental health issues such as anxiety and depression. And if I could just say one last thing, I have a lot more to say because I am a mental health advocate and have been for a long time. The CDC's own February 2021 double mask study reported that masking does impede breathing, which can trigger a variety of problems for children, specifically anxiety attacks. And that's from the CDC. Most everything I gave you was from the CDC. I would just like to say that while we do have a vaccine for COVID, we do not have a vaccine for the trauma, for the anxiety, for suicide, for a lot of the mental health issues that our children are currently experiencing right now because of COVID.
I need you to wrap up, please.
And that's it. I just want us to really think about what we're doing to the mental health of our children.
Thank you. Next speaker in support, Mr. John Cardwell.
My name is John Cardwell. I'm principal of Fairhope High School, parent of an 8th grade student at Orange Beach Middle, parent of a 3rd grade teacher at J. Larry Newton School, and husband of a pre-K teacher at J. Larry Newton School. I'm in my 29th year as an educator in the state of Alabama. On my campus, I have students battling several diseases, cancer, some have licked it, some are beating it as we speak, some with parents, siblings battling it right now. These are the ones I speak for. Wearing a mask is an inconvenience. I don't like it myself. But my number one job at Fairhope High School is safety. I truly believe that every added extra precaution is worth it for my kids as a whole. I also appreciated the medical exemption clause added for students at risk for certain medical conditions. That was thoughtful. As a principal and a teacher, I've looked down on students prepared for burial. I've consoled students at the loss of a parent, recently, a couple due to COVID, and most recently I served as pallbearer at my niece's funeral due to death by COVID this summer. A successful ending to my education career would be to never have to do that again. If a mask helps just a little bit, then it's worth it for all the kids at my school. And this is to Mr. Tyler. I admire your decision. I've been disgusted with personal attacks I've seen in writing about you. Criticize a decision, but personal attacks are gutless and lack character. You and I may not agree on everything, but I'll tell you this. And I want everybody to hear this. The safety and welfare of our students is at the forefront of every decision that man makes. I'm proud to be an administrator in the school system and work for you and this board. I want to thank you for your time, but most importantly, I want to thank you for your efforts in keeping our kids safe. Thank you.
Next, Ms. Lisa Barnes. I'll try to speed this up a little.
My name is Lisa Barnes. I have a master's degree in emergency management and criminal psychology. I'm also the parent of a Baldwin County student. I teach at the college level and have tutored at the elementary school level, and I have witnessed children swapping masks, wiping the lunch table with their mask, dropping their mask on the bathroom floor, and putting it back on their faces before we could catch them. And children are constantly touching their faces. The masks are unsanitary and ineffective for preventing COVID. The federal government approved masks for emergency use authorization only under the FDC Act. Any mandate requiring individuals to wear masks conflicts with Section 360 BBB of the FDC Act, which states that a person must be informed of the option to refuse to wear the device. Consent is absolutely essential, and parents have the right to choose. Besides the right, COVID poses almost no risk to children. There were 4.2 million children who have tested positive for COVID. The number of children who have died, 0.008% of children have died from COVID. Besides that, he talked about the size of it. It's 0.1 micrometer. 0.1 micrometer. The holes in a mask are 5 to 200 micrometers. That's like putting up a chain link fence to protect your child from mosquitoes. I ask that you please review the documents that you were given, including the 2009 study from Dr. Fauci, in which he stated that the #1 cause of death from the Spanish flu was from mask. So I ask that you would please review those for the health and safety of our children.
Thank you. Next speaker in favor, Ms. Nicole King.
Good evening. My name is Nicole King, and I'm the Alabama Education Association UniServe Director for Baldwin County. First of all, I would like to thank you for allowing me to speak on behalf of AEA members here in Baldwin County. Last year, under the guidance of Mr. Tyler and with the diligence of our amazing employees, Baldwin County schools were able to complete a full school year, even with COVID present. Our dedicated employees were on the front lines and devoted themselves to the success of our students. This year, Mr. Tyler has made the progressive decision to require masks for employees, students, and visitors of Baldwin County Public Schools. Every AEA member who has reached out to me has been extremely grateful for this decision, and it has alleviated some of their concerns about COVID transmission in the schools. Our members are very aware that wearing masks in schools and on buses is a recommendation communicated by the CDC and the Alabama Department of Public Health. With the continued increase of COVID cases, it is important for schools to take the appropriate steps for COVID prevention, as well as minimize the spread of COVID in our schools. The decision to require masks is certainly in line with protecting our employees and students as much as possible while delivering face-to-face instruction. Also, as a parent of 2 girls in Baldwin County Public Schools, I'm relieved that Mr. Tyler took this important step for all of the students in our district. While the circumstances around us are far from ideal, the decision to wear masks was made with the health and safety of all employees and students in mind. Board, I do appreciate your commitment and support of Mr. Tyler in this decision. I believe a vote of confidence will show your continued dedication to Baldwin County Public School employees and students. Once again, thank you, Mr. Tyler, for keeping the safety of our children and employees a top priority in Baldwin County Public Schools. Thank you.
Thank you, Nicole. The next speaker, Ms. Wendy Pickering.
My name is Wendy Pickering. I have a 12-year-old daughter at the Spanish Fort Middle School and 2 other children that have graduated from Spanish Fort High School. I'm a registered dental hygienist in the state of Alabama and have over 26 years' experience in acceptable mask wearing and protocols. I'm confident that not one healthcare professional here or anywhere would disagree with my following statements. When I exit a room from a patient, I dispose of my mask immediately. Why? It is contaminated. If I were to wear that same mask for 8 to 10 hours, I run the risk of not only infecting my patients, but myself as well. Yet why are we asking our children to do this? How many times have you seen a child with a mask upside down or inside out? Think about that, inside out. The exact virus that you're trying to protect them against, you are now giving it to them. The virus is now on the inside of their mask and they are breathing it directly into their nasal passages, mouth, and lungs. This simply cannot happen. Therefore, I've come up with a perfect solution. First of all, I'm sure that you would all agree our children's lives do not have a price tag. With that being said, the following should be the new mask protocol. When children first arrive at school, they should be given a clean mask upon entering the hallway. When they reach their first period classroom, the contaminated mask should be disposed of immediately and a clean mask applied. Upon leaving the classroom, the contaminated mask should be disposed of and a clean mask applied. This should also be for the teachers as well. They need to be changing their masks in between their classes. The protocol will greatly decrease the chances of cross-contamination and greatly decrease the chances of our children getting sick and dying from this virus. Each child and teacher would require a minimum of 20 masks per day. Anything less than that is only not acceptable, but almost guarantees our children could get sick or die, or at least would increase the numbers of COVID cases. Being that masks are being mandated by the school, it is only fair that the school bear the burden of this expense and not the parents. So I took it upon myself to do a cost analysis.
Please conclude. You're over your time already.
There are 31,287 students and teachers in the Baldwin County school system. 20 masks each would equal 625 masks, 625,470 masks a day. At an average cost of $19.99 per box, a 50 3-pod mask, you would be looking at a total cost of $43,279,149.60.
Thank you, Ms. Pickering. Thank you. I think we can figure the math.
Okay,
But
great.
Please
We're
take your
just not going
seat.
to put a cost on our children. So please provide the masks if you're mandating them.
The next speaker is Zach Wigstrom. Mr. Zach Wigstrom.
My name is Zach Wigstrom. I'm the principal at Bay Minette Middle School and in my 21st year of education and a parent of a 16-year-old at Baldwin County High School and a 14-year-old student at Robert Steele High School. I'm very passionate about my job, so I'm going to keep this short. If I can do anything that would give our people even a 1 in 1,000,000th chance to not get COVID, I'll do it. Something had to be done. Mr. Tyler and the board have put students and staff before themselves since the beginning. Some of you should be ashamed of some of the things that you have said and posted on social media. Here are the facts. Masks are giving the people that give their lives to your children the confidence to come to work. We need to talk about the employees too. Yes, the number of kids getting really sick are low. However, I can introduce you to coworkers who have lost family to COVID that would argue if masks help at all, we should wear them. Education is about kids, but it's also about the employees. When people have confidence, they will do a better job for your children. If you were to come into my school, you would see happy kids and happy employees. If the mask mandate goes away, we're going to have major staffing issues and you won't have to worry about school. Their confidence will no longer exist. I hate wearing masks, but I'm willing to do what it takes to keep myself from possibly spreading COVID to others and to set an example to my students and staff that I will do whatever I can to be safe, even if it's a small one. I trust the doctors who are actually trained to make the healthcare decisions. I trust my doctor, who is sitting right there, And I also trust Mr. Tyler, who is following the recommendations of the physicians. I will ask that when this is all over, and it will be soon, that you are as passionate about the good things that are happening in Baldwin County schools as you are about fighting against this mask mandate. Because if you do, this county will be unstoppable.
Next speaker, Ms. Michelle Rayburn.
I am a mom of 4 children, 3 of which are in school currently. I have seen how the masks affect my children every day. My 7-year-old...
It's okay.
...who loves school, and he's very active, social, hands-on kid, but he has some health challenges like asthma, allergies, and eczema. His asthma is so bad he takes a steroid inhaler morning and night. He's on albuterol. At times in between, it still doesn't pass his breathing test when we go to the doctors, but it's considered controlled because he's not in the hospital regular. Since we were told that masks would not be mandated in schools, I allowed my children to return to school this year. He struggles to breathe in mask, and as of this last weekend, had an eczema outbreak around his ears from wearing the mask, which he doesn't normally break out with his eczema there. Because of the mask, his asthma has also picked up. When he comes home from school, he's coughing more and wheezing to where he has to have an inhaler coming in from school as well. He's getting eczema in spots that his mask, where it rubs, he never previously got it there. And it's already a struggle with him. He doesn't understand why he has to take all these medications or why he has to do all this. It's a scary thought to think that my son will be lost because of an asthma attack, because teachers cannot see how he's breathing through this mask. I know if I struggle seeing, the teachers can struggle seeing it as well. Our household has already dealt with COVID, and my children had an easy time with it. I would rather deal with another round of COVID than to see him struggling to breathe in the hospital with asthma attack. Those attacks are something that can be prevented if he was allowed to be mask-free with my permission. Since our school board waited to mandate masks until it was too late to register for virtual school, my children now have to go to school with masks. That's mask that you say protects him that could ultimately be the very thing that causes his life. They're my children, not yours. I just ask that it be my choice to decide whether they're wearing the mask or not.
Thank you, Ms. Rayburn. Ms. Morgenstern, or Mr. Morgenstern, I'm sorry. Yeah, Ari.
Good afternoon. My name is Ari Morgenstern. I'm here speaking exclusively for myself and for my 2 children in the Baldwin County School District. And I'm very, very grateful to all of you for your time today. I've followed this debate over masks, and I acknowledge that it is about science. And I'm not a man of science, but I am a man of faith. The Judeo-Christian tradition places an exceptional emphasis on life and on loving thy neighbor. Paul wrote, "Let each of you look not only to his own interests, but also to the interests of others." In the Jewish Talmud, it says, if you save one life, it is as if you have saved an entire world. For me, therefore, this debate is simple. If those who support the mask mandate are wrong, we suffer discomfort. If those who oppose the mask mandate are wrong, we imperil human life. There was a political scientist named David Mayhew who once wrote that elected officials are, quote, single-minded seekers of re-election. Now, I don't accept that pessimism at all. But I understand the instinct towards political survival. I do. And I would leave you with the words of Ezekiel, if you feel that gnawing. Ezekiel said, "Woe to you, shepherds of Israel, who only take care of yourselves." And I don't say that just to the board, I say that to every person in this room. Y'all are the shepherds in this context. And if you're wrong about the masks, then all of the illness and all of the suffering and all of the death, it's on you. So it is my sincerest hope and prayer that you all choose to err on the side of the preservation of life. I want to thank the board. I want to thank Superintendent Tyler for your service. Thank you all for your time.
Thank you. Thank you, Mr. Morgenstern. Next speaker who is opposed, Mr. Yeah. No. You're right. I'm right. Mr. James Carl.
Good afternoon. I'm James Carl, a 10th grade student at Spanish Fort High School. I'm a straight-A student with no disciplinary record. Wearing a mask should be a personal decision. Healthy school students have virtually no risk of dying or even being hospitalized. According to the CDC, not a single healthy child in Alabama has died. We only get sick. Harvard studies concluded that children do not contribute much to the spread of the virus because we aren't symptomatic. We are kids. It's okay if we get sick. That's why y'all have always allowed us 9 sick days. I thank you for trying to save us, but we aren't in danger. If a parent believes their child is in danger, let them make the call. Virtual school and wearing a mask will always be an option. Please stop trying to fix something that isn't broken. I tell you what is broken though, my high school experience. Remember when you were in high school? Remember the good old days? Remember how fun it was? I haven't had a school dance or pep rally in almost 2 years. Remember seeing your teacher smile? Remember understanding your teacher? Half the school is wearing old, dirty masks. I've seen plenty of kids even wear their friends' used masks when they forgot theirs. I don't need the CDC to know that's unhealthy. The cafeteria is my favorite time of day. Hey, bro, are you going to eat those fries? Don't be fooled. Separating us during lunch will not keep us from being normal high schoolers. We will still contract the virus elsewhere. Boyfriends and girlfriends will still kiss, team members will still share water, and we will still pack our cars full to go to Sonic. I hope every one of you had a great high school experience. Don't you think my generation deserves one too? COVID, just like the flu, will never go away. Are you planning to extend the masking till the end of time? Do you realize you're putting the interest of the adults above the well-being of the children? My parents love me more than any of you ever could. Parents do what's best for their children. Please protect yourselves without sacrificing us. Thank you all for your time.
Mr. Carr.
Audience.
Mr. Carr. I apologize for Mr. First. Where are you a student?
A Spanish Fort High School.
Spanish Fort High School. You're a senior?
No, I'm a sophomore.
A sophomore?
Yes.
Okay. So you have your junior and senior year left, correct?
Yes, sir.
Okay. Well, if I remember correctly, because I'm the one to make the call, proms and homecomings were allowed your sophomore year. That was allowed. I mean, I can't speak for your school, but that was allowed from me. So I just want to make sure we're clear on that.
I know. I would like to be able to dance in my school. That's why I was not allowed.
It didn't come from me, but I just want to make sure that's clear.
Thank
Okay.
you.
Okay, we need to move on. Thank you.
Thank you.
Next speaker is Dr. Michelle Moore.
Hey, good evening. I am Michelle Moore, and I am the principal at Foley Elementary School. I'm in my 30th year of education, and I also have 5 sons who are all adults. I just wanted to share that because we all have families who are employees just like you guys do. I'm here to speak for my teachers and my faculty and staff members. If we lift this mask mandate, I feel strongly we are not going to have teachers to serve our students. Just this week, I've had a teacher whose son-in-law has died at 29 years old and left his 25-year-old wife with 2 children. Last week at meet and greet, the 4-year-old comes into my office to meet me, and the first thing he says to me is, "My daddy's in heaven." I also have another employee who just this morning lost her 25-year-old nephew who had no underlying health conditions. I have another employee who yesterday went to the funeral of her brother-in-law. I have watched these people cry, upset, and not come to work. When that happens, I don't have people to cover classes. That's a problem, because then we can't serve your student like we know that we want to do. We cannot social distance these kids. We don't have the space. I have almost 1,000 students in my school. It is impossible to social distance. If we have masks in place, the hope is that we can keep our teachers in school to serve your children, which is what we need to do. I had a survey sent today to all of my faculty and staff, and if the mask mandate is lifted, I had 6 say that they will consider retirement now. I just want everybody to think about that, because I'm having trouble covering classes as we speak. Since I've been here, I've already had an email saying I can't come to work tomorrow because I'm positive for COVID. Thank you.
Thank you. Macy Nelson.
Thank you. First of all, thank you for this opportunity. I'm not going to bore everybody with my degree in science because I don't think it matters. I think everybody has the facts that they need to make a decision. But I just want to say there's a disconnect. And I think that's why there's a lot of headwind in your way with the masks. As I sat here tonight, every medical professional that came on this podium, except one, took their mask off and spewed this podium and microphone with respiratory droplets. Does COVID know if I'm at the podium versus sitting down? Does COVID know if they're at lunch or if they're in a class? Does COVID know if they're in a class or on the football field, soccer field, volleyball court, basketball court, tennis court, etc.? So we have a son that goes to Fairhope, you know, and he's 13. He doesn't understand. He comes home and he says, how come I have to wear a mask for 8 hours, which is filthy. I want to echo, you beat me to it, 2009, Fauci co-authored a paper about the #1 cause of RSV after the Spanish flu is prolonged mask wearing. So there's that. But on top of that, I want to echo the point about changing the masks out. And if we're really going to buy into this, capturing those COVID, and we're talking about supposedly the most deadly virus the planet's ever seen, and if I have it, now this mask have it, where are the biohazard cans to dispose of this medical waste? They're either work and they're catching those droplets and we're not disposing of them properly. Next, I know there's a lot of pressure. Last thing I'm going to say, that I know that there's a lot of pressure from Montgomery. But what's next? Mandate no prayer in school? Mandate no pledge in school? Mandate no flag in school? This is a slippery slope, and if you are concerned about what you feel is a crippling pressure from Montgomery, we have your back. This district will have your back. Mr. Tyler, board, beloved law enforcement, we will have your back on this if you don't yield to the pressure of Montgomery to mask mandate. Thank you.
Stephanie Miller.
So sorry, I have a totally separate situation from the COVID. I thought this was going to be open. But I'm in favor of wearing the mask. I am a frontline worker, and I think we're doing what we can to protect our kids. The only other issue that I had with this school year was there was some communication in one of the local schools about transgender bathrooms. So I don't know we need to, can you come back and address us? I'm sorry, I really am. That's okay. I didn't realize that this was just going to be COVID.
Okay, all right.
Thank
you, Ms. Miller. Please come back and address when you can.
Okay, thank you.
Thank you. No, we're not deferring times. Let's see, I guess I need to go to Brent Wiles. Well, she wasn't really on it, so it's, yes, Mr. Wiles.
This is a for the mandate spot?
Yes,
okay.
Yes, you're right.
All right. Good evening. My name is Brent Wiles. My wife is a teacher, and my children are students in the Baldwin County Public Schools. I want to express my clear and unequivocal support for the mask mandate for students and staff. For me, I hate to echo, it's a simple question regarding the cost of being wrong. If the anti-maskers are right and the doctors, scientists, and public health experts are wrong, then our students and employees will have worn an inconvenient piece of material on their face for a few more weeks or months than needed. If the anti-maskers are wrong and the doctors, scientists, and public health experts are right, then our school system will have taken a reasonable measure to protect the health and safety of students and employees, and lives will have been saved. Regarding whether or not the mask requirement should be mandatory, of course it should be. It has to be. All we need to do is look at the shockingly low vaccination rate in our community, look around in stores and see the number of people not complying with voluntary mask requirements, look at our overloaded hospitals and exhausted healthcare workers after the vaccine's been available, to see that far too many of my neighbors and community members will not make the choice to protect their lives or the lives of those around them. Almost all of the BCBE students are minors. Too many of our children are not yet eligible for vaccination, and too many parents are scared and misinformed. Frankly, to protect our students and staff and try to keep our doors open and children learning, the school system must mandate masks now and continue to do so until there is a consensus amongst local medical professionals and hospital administrators that it is time to stop masking. Thank you.
Thank you. Michael Renforth.
All right. Good evening, and thank you for having me out today. I do want to say that I am pro-choice. I'm not going to tell you to take off your mask. I'm not going to tell you to put on your mask. It is your choice, correct? We started this meeting out today with the Pledge of Allegiance, correct? That is the allegiance to the flag, to represent America. We are Americans. In America, we represent freedom, correct? Land of the free. In order to be free, we need to represent freedom, right? If you don't have your freedom of speech, your freedom of choice, that takes away from what America is. We are brave, we are free. America is a lot more than that, but I just want to come up here and let you guys know that if you are American, please be considerate to others. Please understand that you have your choice. The choice is yours. If you do not want to wear your mask, if you do not want your child to wear the mask, that should be your choice. I'm not going to say that if you want to wear your mask, you shouldn't. If you feel like you need to wear your mask, please wear your mask. I'm out here today. I didn't have a speech or anything. I don't have a degree. I am a simple man. I have 4 children. I have 3 in school right now. I do believe that we need to come together and as Americans and as people and respect one another, right? We need to respect one another's opinions. We need to make sure that we represent what America is: freedom, freedom of speech, freedom to make your own choices. That's all I have. Thank you, guys. I appreciate your guys' opportunity that you gave me. That's it. Thank you.
Thank you, Mr. Winfrey. Jared starts with a B.
Budlong, horrible handwriting. Jared Budlong, I'm a Baldwin County resident. I have two kids in our school system. And I also don't have any fancy credentials. I don't want you to listen to me. I want you to listen to the medical community, not only locally, and I appreciate everyone that has spoken about that locally. We have a global scientific community that has a consensus that masks are effective in helping to transmit COVID. Continue to listen to them, and as soon as they change that, feel free to take away the mask mandate. But until then, please protect my kids from the potential harm of having COVID spread to them unintentionally by non-symptomatic carriers. I appreciate it. I yield my time. I don't have anything else to say.
Thank you. Jeremy Beck.
My name is Jeremy Breck, and I'm a proud father of 2 Pirate football players at Jerry Larry Newton. Mr. Tyler and this school board have unilaterally decided that our kids and school staff should wear muzzles 40 hours a week like Gitmo detainees. I have listened to the arguments from NIH-funded USA Health medical practitioners talk about vaccines, and hospital capacity. Not one of you mentioned prophylactic and early treatment with things such as quercetin, ivermectin, zinc, and vitamin D. Alabama kids have a greater chance of dying of the flu, car accidents, drownings, homicide, suicide, and diarrhea. Wearing a surgical mask for long periods of time will lead to reduced oxygen levels, increased anxiety, asphyxia, bacterial pneumonia, brain fog, decreased learning capacity, weakened immune systems, infections, hypoxia, hypercapnia, cardiac overload, and increased chronic disease such as Alzheimer's, dementia, and cancer. This is historic fact, proving risk and injury. Besides being harmful and belligerent, you all are breaking Alabama and international law. Four Class B felonies. Suffocation is defined as intentionally causing asphyxia by depriving a person of air or obstructing the airway of a person. Menacing is committed if one intentionally places another person in fear of imminent physical injury, including protracted impairment of health. Child abuse is defined as harm or threatened harm to a child's health or welfare by a person responsible for such welfare. Neglect is defined as harm to a child's health or welfare by a person responsible for said welfare, which occurs through negligent treatment, including the failure to provide adequate medical care. The evidence I have provided makes it clear you are breaking the law and causing serious physical injury with your policy. Nuremberg Code states no one may be coerced
Mr. Beck,
to participate.
Your time is up.
Just give me a second.
No, it's been up.
You gave
Mr.
other people
Beck.
time. We have the freedom to choose.
Mr. Beck, please take your seat.
Thank you, and God bless America.
Ms. Shannon Melton.
Hello, good evening. My name is Shannon Melton. I am a 3rd grade teacher here in Baldwin County at J. Larry Newton School. I will say, I think we can all agree that COVID doesn't discriminate, especially this Delta variant. I have family members in the medical field at Thomas, South Baldwin, Mobile Infirmary, USA Women and Children's, and they all, whereas maybe a year ago had different, opinions, they all agree that this Delta variant is far worse and far scarier than what it was a year ago. I can truly say, like, I wasn't scared last year. I'm a little terrified at what we're facing right now. It's scary. The numbers that I heard from you, the ages that you were saying at Thomas, sorry, I'm just echoing what you were saying, 20, 30, 40-year-olds, that's what they're seeing. These are the people ending up on the ventilator. And that's a lot of teachers are in that age, you know, and we don't know how it's being transmitted. I guess we don't know everything. We're still learning, but I think we can all agree that I think the board and Mr. Tyler and his decisions, he's doing what he knows is best for students, teachers, and staff. I think the biggest goal is to keep the schools open. Teaching virtually, not my thing. I want to be in person, even if it's with masks on. I love to see the kids smiling. You can see under their eyes, they're still smiling. I do my best to, you know, build relationships with the kids. I feel like that's important, and that's hard to do when we're not at school. I'm very thankful that we're in a county where parents have the choice to send their kids to virtual school, homeschool. You could do a private school, you know, whatever. We have choices. That's the great thing about here, living in America. So I just want to say that there's no doubt that it's worse. Grocery stores are closing down. They weren't a year ago. But I think the biggest thing that I want people to know is, like, we all are making the best choices.
Ms. Melton?
Yeah. We're all making the best choices that we know how to, and I appreciate you making the choice that you think is best for teachers and students.
Thank you. Mr. Kincaid, David Kincaid.
Thank you very much for letting me speak tonight. I'm a Baldwin County resident, got 3 children, 15, 7, and 5. My 5 and 7-year-old, 5-year-old doesn't have to wear a mask, my 7-year-old does. That's a great conversation I have every night with that 7-year-old. So that being said, she asked me why COVID's still around. I tell her, well, the school system says you have to wear it. We abide by it because we're law-abiding citizens. I think you need to look at the children because you have different sets of rules for each one. I have family that sees both of those rules. They play with each other. They eat lunch at the same time. One has to wear a mask to get her lunch. The other one doesn't. They sit across from the table from each other. Makes no sense to me. I don't know why y'all mandate these masks. It should be my choice, not your choice. If somebody wants to wear a mask, let them wear a mask. I choose not to let my children wear a mask because they like to breathe fresh oxygen. On behalf of that, I would like to say the COVID-19 survival rates from the CDC as of today, 0 to 19 is 99.997 survivable at that age group. So think about that when you make your decision about mask mandates. I yield my time.
Thank you. Kylie Hensler? Sorry.
Hello, I am Kylie Hensler, and I'm a 3rd grade teacher at J. Larry Newton School here in Baldwin County. I really just kind of wanted to talk to you a little bit about my job and my family. I genuinely enjoy going to work every day. I love my kids, which are your children. I don't have children of my own. The kids that I consider my family are your kids. I love seeing them every day. I love being with them every single day. My first year teaching is when we went out for COVID in 2020. It was devastating. I missed my kids missed me. We have fun every single day. If this mask is what's going to protect us and keep us in school, I'm all for it. I think that this is a small thing that we can do to keep our kids in school every day. I am right now seeing the effects of what we have with our children from being out of school in 2020. It's rough. It's hard. The social emotional side of it is more impacting our kids right now than the academics of it. They love their friends. They love their teachers. They love their school. And we love them. If this is what we can do to keep us in our school, then that's what we need to do. My family is the people that I work with every day. My dad is in this room, my mom is in this room, my best friend's in this room. My kids are your kids. All we ask is that you help us stay and protect our kids and our family. Thank you.
Thank you. And please just let me remind everybody, and I understand and I appreciate speaking to each other, but please remember, we need your comments directed toward the board. Thank you. Saying that Mr. William Casey.
Thank you.
Sure.
This has been a very educational experience tonight. I want to thank the board for having it. We are all in this together. I really don't consider myself pro-mask or anti-mask. I understand the board has to try to put people in categories for obvious reasons, but I think like most people, it kind of depends on the situation. I think we can solve this problem, and I think that there are a lot of things we need to be aware of. I think we need to keep things in mind. There are a lot of people who will use any issue to cause problems between Americans and divide us. We cannot let that happen. Once again, we are all in this together. Sometimes we do need to follow the money to see who is making money in certain situations, because as mankind is, there are people who will capitalize and profit from the misery of others and for opportunities that shouldn't exist. We need to keep our heads and remember that God is in control. One problem a lot of people have is we don't know if we can trust the government anymore. At first we heard that we shouldn't wear masks. Then we were told to wear a mask. Then we were told once you get vaccinated, you don't need a mask. That was said by the President of the United States. Now we're being told that we need a booster shot. I ask that people understand that people's behaviors a lot of times are based on what they've learned in the past. I do have some solutions I'd like to recommend. We have a new school in Fairhope. Perhaps we should use that for one group and one group only. Perhaps we should segregate classes into pro-mask and anti-mask. Let one teacher teach one class where people aren't worried about it. Perhaps we should divide schools. Perhaps we should use separate times, in the morning for pro and the afternoon for anti. Mexico does two class times. School vouchers may be a solution. Homeschooling, and sometimes the best is to do nothing. And finally, sometimes we may perhaps should let just people choose. Thank you so much, and thank you.
Thank you. Ms. Cassie Morgenstern.
I have two children in Baldwin County Public Schools, but tonight I'm speaking on behalf of 4 medical doctors in Baldwin County who are also parents of children in the Baldwin County Public Schools. I'm going to read one of their statements. My name is Dr. Jennifer Walker. I'm a local pediatrician and parent of 2 children who attend schools here. I could not be here to speak tonight because our clinic is inundated with COVID patients. Baldwin County is in the midst of by far our worst COVID outbreak since the pandemic began. And all of our healthcare resources and personnel are stretched thin. Delta variant is highly contagious, highly prevalent in our community, and causing much more disease in children and young adults than we've ever seen in the past 18 months. In the midst of all of this, our only protection we have to offer our precious and vulnerable children who are too young for the vaccine is consistent mask wearing. Some try to say that masks don't work, but this is ludicrous to anyone in the healthcare field, where masks have always been part of our protective equipment when dealing with dangerous, contagious respiratory viruses. Some try to say that masks are too uncomfortable, and we can all agree on that. However, we give up a little bit of comfort for safety all the time. Car seats, life jackets, bicycle helmets, and football pads are not comfortable either. But we wouldn't dream of denying our children those protections when they need them. Some try to say that it should be left up to the parents, whether they want to protect their children or not with the mask. However, each person who is unmasked in an indoor setting puts every person around them at risk. While any child will be safer in a mask than without a mask, they'll be safest if the children around them are also wearing masks. And parents should not be allowed to make so-called personal choices.
Watch your time.
That will put other people's children at risk. Thank you.
Thank you. Larry Salty.
See how low this thing can go. First, I want to thank the board for allowing us all to be here today. Thank you so much. I'm not a doctor. I'm not an attorney. I'm a grandfather. I do live here in Baldwin County. My wife and I followed the mandate, wore masks, we got COVID. According to multiple reputable studies, it is a myth that masks prevent virus from spreading. The CDC website's the surgical masks do not catch all harmful bacterials and particles. Particles in smoke are 5 times the size of the COVID virus, and it will not stop all the particles and smoke. It is like throwing sand against a chain link fence. It's not going to stop anything. Primary Doctor Medical Journal posted their findings of 6 trials of 3 types of masks: a disposable surgical mask, N5 mask, and a laundered cloth mask. In less than 10 seconds, the available oxygen decreased to less than the OSHA required minimum of 19.5%. Are we going to have medical staff at all the schools to check the oxygen and blood level in these students? University of Florida lab analysis of freshly laundered masks worn 5 to 8 hours by children ages 6 to 11 found 11 dangerous pathogens on the mask, to include meningitis, food poisoning, sepsis, to name a few. Everyone familiar with the Nuremberg Code of 1947, which we've discussed, knows that the law is very clear. It is unlawful to conduct medical research without informed consent of all parties. That means it has to be voluntary, and forcing children to wear masks without a child's parental consent is illegal and immoral. By requiring children to wear masks, you're promoting the idea in their head that masks can prevent the disease. This is wrong and just impractical. According to the FTC Act 15 U.S. Code Section 41, it is unlawful to advertise that a product can prevent disease unless you possess competent and reliable scientific evidence.
Mr. Salty, I'm sorry.
Yes.
Your time is up.
The only thing I ask that we do allow the parents to decide this.
Thank you.
And be aware of the legal ramifications involved, because the
Thank you.
government is given responsibility to you.
Thank you. Mr. Matthew Myrick.
First, thank you, Superintendent Tyler, for working to keep our kids as safe as possible. My name is Matt Myrick, and I have a daughter in 3rd grade and a son in 1st grade at Fairhope West Elementary. My 1st grader has cystic fibrosis, which, if you're unfamiliar, is a genetic lung disorder that can lead to frequent infections and hospitalizations. I recently saw a picture of a sign at an anti-masking rally that read, "0 children have died from COVID who didn't have pre-existing conditions." And it hit me, what a sad reason to argue against masks, because even if that were true, the sentiment is take off the masks because it's only those kids we'll lose. As the parent of one of those kids, I've been shocked how often I've witnessed disregard for vulnerable people when it comes to COVID. How often I've seen someone on social media complain about masks and say, if you're at risk and worried about COVID, you can stay home. Last year, my family stayed home, and we learned firsthand the limitations of the virtual school format. Thankfully, our brick-and-mortar schools limited the spread of COVID using measures like masking, and my son's pulmonary team at Children's of Alabama recommended in-person learning this year, in part because they witnessed a decline in overall mental health for many of their patients in distant learning programs last year. You should have seen how happy my son was bouncing into the building to meet his teacher this year. I'm so proud that our schools work to accommodate kids with disabilities, and I'm grateful for the rights you guarantee them. Our schools care for students with all sorts of health problems like diabetes, cystic fibrosis, and other lung conditions. I believe because we all value their contributions to our public school community, and we want them present and safe. The kids with files in our nurse's office are future doctors, engineers, and community leaders if we take steps to protect their futures. But we must continue listening to the experts, as you said, the in all caps in your message. Experts like Dr. Michael Chang and our friends at Children's and Women's Hospital and USA Health. Superintendent Tyler, you were correct. We can't let partisan or local politics dictate decisions concerning our children's health. Thank you.
Thank you. Lauren Allen, Miss Lauren Allen. Or Mrs., sorry.
My name's Lauren Allen. I have 2 children in the Baldwin County Public School System. I come here today to tell you about my son, who suffered from chronic migraines, chronic nosebleeds, chronic fatigue, and debilitating anxiety during this last school year. He was ridiculed in front of his classmates by the very people he was taught to trust because he just wanted to breathe without struggling. Summer break began without a mask mandate to follow. My son's nosebleeds quit, the chronic migraines started to subside, and his anxiety turned into laughter. Excitement for the fast approaching first day of school quickly turned into fear and anxiety as a mask mandate was put into place for Baldwin County Public Schools. Last night, on the 5th day of the new school year, his nosebleeds began again. After spending countless hours reading medical literature upon effectiveness of masks on children, it is obvious that there's absolutely no scientific proof that masks are an effective barrier against viruses. Furthermore, I've brought with me documents citing peer-reviewed medical publications that warn against the detrimental psychological and physical effects of forcing children to wear masks. Breathing impairments due to carbon dioxide volumes, migraines, dizziness, oxygen deficiency, decreased cognitive ability, neurologic, metabolic changes, disrupted breathing patterns, dehydration, gum disease, inflammatory disease, self-contaminated harmful bacteria known to cause pneumonia, tuberculosis, meningitis, and skin infections, depression, anxiety, emotional processing implications, and social behavior issues. As a parent, I am responsible for my son's health and safety, and the school is responsible to do no harm. No matter what side of the debate you are on, we have all heard over and over again, follow the science. The science clearly shows the masks for children are detrimental to both their physical and mental well-being. I ask you to follow the science and reject any mask mandates in our schools. I know schools in this litigious society are concerned about assuming liability for their decisions. Where does the liability begin when mandates are forced by administration against the wishes of the parents to the detriment of a child?
Ms. Allen.
It is the
Ms.
parents'
Allen,
right to choose.
Thank you. Karen Myrick.
Good evening, Board and Superintendent Tyler. Thank you for this evening. I'm Karen Myrick, and I'm a retired educator from the Fairhope Public Schools, and I have grandchildren now in the Fairhope schools. When I remember teaching, I remember fire drills, tornado drills, lockdown drills, active shooter drills, and many other procedures that were all in place in our schools to keep all of our students safe from potential harm. As a former teacher in our school system for 20 years, I was required to keep safety precautions for all of these on my desk visibly and in place at all times. We had to prepare and plan for the unexpected if we were to honor our responsibility for the care of our students. The safety folder was a reminder to me always that as much as parents might want us to send their children home with a brilliant Baldwin County education, what mattered most to those parents and grandparents like myself, whether it was voiced or not, is that we send the children home safe and well. During this tragic pandemic, our children and our teachers and our staff have been faced with a present threat of a potentially life-threatening disease. I appreciate that thus far Baldwin County schools are doing what they have always done well, and that is to protect all of our students based upon best practice procedures. At this time, that's a protection from a deadly disease. To address this coded threat, thank you.
Thank you.
Thank you.
The last speaker for this evening, for invited speakers here, Dr. Campanosi.
Thank you all for holding this tonight. I think it was an important way to listen to the people. Let me say at the beginning that we've heard to follow the science, and yet the science doesn't really speak to the mask efficacy. I would argue that if we are going to follow the science, you've got to find a way to balance the opinions that are out there. 2009, Fauci says no to masks over the N1R1 COVID. Then you have another situation where the CDC itself in 2009 says no masks in schools, all right? Then run the reel up to last year, and the WHO, I hate to even reference them, but nevertheless, they said no to masks. Then they said yes, then they're back to no. The Surgeon General in the middle, about March, said no to masks. There's no definitive opinion about it. The other argument that I would suggest to you here is that somewhere along the line, especially when you see the evidence that we've already shown, that whether it's Sweden, Ireland, North Carolina, or the FAIR study out of Johns Hopkins, all of those showed that no masking was necessary, no rise in infections. And so the biblical references that someone made earlier, I'm sorry, we're not going to be responsible for people dying because we didn't support masking. The evidence shows that masking doesn't necessarily translate into safety. In fact, just the opposite based on the statistics that we've seen. I would urge you to take a closer look at that aspect of this. In my conclusion, I think it's important that we look carefully at the facts. Emotions have been laid out here tonight, and the heartfelt stories are there. There's no question about it. We're not here because we're heartless. We're here because there are parental rights at stake, there are constitutional rights at stake, and it just seems to me that we've kind of gotten past the necessity of looking out for those rights. I know I'm out.
Yes.
Let me just say one final thing. I've been working with Doctors Calderwood and others about various aspects of what's happening here. And this hospital crisis that I've heard about tonight, there's a guy that I've been working with, Stuart Tankersley. He's a colonel in the National Guard, the Alabama National Guard. I don't know if you all have talked to him, but if you want to talk to me afterwards, I'll be more than happy to talk to him about this very issue
I've
of
given you
bringing
the
the
same
National
extra
Guard to
minutes I
help
gave
you.
to everyone else. Thank you. Thank you very much. First of all, at this point, we're moving into what is now on our agenda as other business, which is the business of the board. So before we get into that discussion, let me say thank you to each of you that are here. Thank you for expressing your thoughts. I think that you can tell, not only by the time we've been here, but by the information that you have heard, that the job is not easy, and that we're in a position, if you think about us totally as a board, where there are many times when we have to remove ourselves from just personally maybe who we are and collectively think about what our responsibilities are. The one thing I would say to everyone here also is to remember the numbers with which we're all talking. We understand you're talking about your family, your students, your neighbors, I understand that. When we sit here with the superintendent and recommendations and discuss and talk and ask questions of staff, we're not making decisions for our families that are 11 people, 20 people, 40 people, 50 people, 60 people. We are doing our dead level best to make the best decision we can for 32,000 students and over 4,000 employees. That's nearly 40,000 people. Understand the magnitude of that if you can, and just wrap your head around that, because that is to us an awesome responsibility, and a number of people, including those children and those employees and their extended family, their grandmothers, their aunts, their cousins, those numbers go on and on until you're virtually talking about the population of Baldwin County. So I also want to mention two things. The first thing I want to mention is something that we refer to, and this term you will hear, as daily operational decisions or policy. The simplest explanation of that is daily operational decisions are those decisions that have to be made in a situation that can be temporary. So the superintendent, senior staff get message from the weather station, there's 20 inches of rain and flooding before the buses can get home. And they make a decision, a daily operational decision, to send buses home before school is out at an earlier time with the rapid notification policy or situation we have in place. A policy is a rule, a procedure outlined, voted on by the board that is permanent. It is permanent until that board votes again, or that board or another board 6, 10, 8 years later changes their mind and changes the policy. So you need to understand there is a great deal of authority given to the superintendent for daily operational decisions. It would be impossible to get the 7 of us back once a day or once every other day or whatever to make some kind of decision that is easily something he can make himself, and especially if it's only temporary. Now, this COVID is a very serious thing, and none of us doubt that. I don't believe any of us doubt that. I also believe that everybody in this room, like me, believes that our most precious commodity in this world is our students, our children, our grandchildren. I have 5 great-grandchildren. I cannot tell you how precious they are to me. So I want to lead in with that, because we are now getting into the discussion phase where I will be turning this over to the board, and we have the option. Aside from our discussion, we also have the option of considering a resolution. And if someone can put those last couple of paragraphs up on the screen for me, please. I'm going to read just 2 of these whoops, wrong page. Two of those paragraphs, they're there. I think you can see it. Therefore, be it resolved by Baldwin County Board of Education that we proclaim August 19, 2021, full support of the Baldwin County Superintendent of Schools as he navigates the challenges of COVID-19, which again, we understand maybe when the peak is dropped or what, things can change. It's kind of temporary. It's a kind of thing that could be temporary. COVID-19 pandemic, we support his decision to keep schools open. This is the most important thing I want to say. Keep schools open for in-person learning, and then you can read the last paragraph. The other thing I want to say is the greater challenge that Baldwin County Board of Education has upon its shoulders is to make absolutely certain that we give the very best education we can to every single student. Ma'am, could you put your mask back up on your face again, please? Thank you. To give the very best of education we can to every single solitary student in Baldwin County who chooses to go to one of our schools. And we intend to do it and want to do it in the most effective way possible. One thing that is paramount in having effective education, we believe, and others can speak for themselves, I don't think they're any different, is face-to-face education. We've heard from everyone, you need your children in school for all kinds of reasons, from emotional to social and multitude, including the kind of special care that's given to some of our special students. So we think the most effective way to education is a face-to-face education in schools with our teachers in the safest way possible. And I open that discussion up now to the board for the discussion of how do we see this in best possible. And we have to take ourselves and our emotions out.
I know the board's going to enter into discussion. I want to clear up a few things. I'm an appointed superintendent of Baldwin County Public Schools. I'm not an elected official. I'm not a politician. I'm a superintendent that has to deal with politics every single day. The board hires a superintendent to run a school system, and that's what this board has allowed me to do. There's been something said out there that basically, it wasn't a board decision, it was an Eddie Tyler decision to go mask. That is 100% true. I called the board president the night before, told her what we were considering as a courtesy, and as a superintendent that's in charge of educating and the health and safety of these employees and students, I made that decision. I've been hearing about data suggests that there's a small percentage that might die. Well, I'm not into the habit of collateral damage. You know, let's just, somebody can be sacrificed for the greater good. I'm not in the habit of that. I'm sorry. Also, somebody made a comment about pressure from Montgomery. I'm not sure what you're talking about. Dr. Mackey has allowed every school system to go their own path. No politician has called me. None. Zero. And said, you need to do this. So I just want to clear up a few things there, and the board can decide tonight. They can decide whether we continue or we don't. It's their decision now. I made my decision, it's been clear. And I don't regret my decision.
All right, board, we're ready to hear from any of you who might be ready to.
We need to go in order. We just jump in there.
Just jump in there, Mr. Christenberry, anytime you feel like it.
Just jump right in there. First of all, I want to say that this meeting was eagerly anticipated, right? And I want to thank you. I want to thank you, number one, for your passion advocating for children, because that's what this is about. It's been said. We might not agree, but we're advocating for our children because that is our precious, most precious asset. And you know, there's been meetings like this around the country, and a lot of folks are watching. I just got a text. I try not to watch this. I got a text from Atlanta, Georgia. And it was somebody that knows me that knew about this meeting, and they're watching us right now. And they said, man, y'all know how to do it in Baldwin County, don't you? Thank you for that. Thank you that we're here together. That's right. When we say Baldwin proud, there's a lot more to Baldwin proud than some of us even realize. That I'm grateful that we're here together, and we may be diametrically opposed on some issues. One thing, there's so much that we have in common, and that's our children. I have supported this decision from day one because I trust Eddie Tyler. I trust his decisions. I've known him for many, many years, and he would never, nor would anybody on this board, do anything to harm a child. And I tell you, the science can be overwhelming. And it's like we can find studies to fit my bias, back and forth and back and forth. But I'm excited tonight for us to have a resolution to give us an opportunity to stand behind Mr. Tyler. I hate this thing. I don't hate the Fairhope part. I love that part. But I don't like wearing a mask. I don't like making a child. But if a child, I won't even go back there. I'm just saying, we're charged with making a very tough decision. And honestly, I'd rather err on the side of caution, and I'm honored to support this decision with the idea, please, Lord, that it's over with as soon as possible. Some are shaking their head. I pray that it is, and I think we want it to level or whatever it does. I'll shut up now, but I'm just thankful that you're here, and I'm thankful that this has gone so well so far. Let's don't mess it up now.
Anyone else?
I'll go ahead since I guess I'm the freshman member up here, and yeah, this is exactly why I ran for Baldwin County Board of Education, but it is why I ran. So some of the things that I've learned as I've come on are different than my business life. I'm a businessman. I'm not an educator. I try to come from a slightly different angle, but I'm also a grandparent. I had 3 boys that graduated from Baldwin County schools. I graduated from Fairhope many years ago. So one of the things that I learned coming into this, and I heard it said when I was attending meetings before the election and after I was elected, that the superintendent has been hired to make the decisions, and probably one of the greatest decisions that anybody can make is the health and welfare of another person. To me, that is this has been one of the most invigorating things for me, because we are sitting here and we are dealing with the health and well-being, no matter whether you believe with the mask or not. So when Mr. Tyler came out, I'm a good soldier. I supported Mr. Tyler in his decision. Now, what my personal feelings are about masks are different. And I'm not afraid to say that, because there's been some great points brought up tonight about unsanitary masks and the mental part of it, and I appreciate every one of them. But I've had some just great comments from the medical people. I know that what they're telling me is the truth. I don't doubt anything that anyone else has told me the truth. But at the end of the day, I have my personal decision and my personal beliefs. And then I have the fiduciary responsibility of the children, the employees of this county. You say, well, that sounds like a political answer. Well, I'm sorry, but that's the answer that I have. I appreciate it.
Thank you. Anyone else?
Yeah, I called Mr. Tyler, and I told him when he made the decision that masks would be optional, and then 3 days later it flipped, and we had to wear the mask. You know, I taught school for 30 plus years. I appreciate the parents. If it wasn't for the parents, we wouldn't even be up here. So I've always been pro-choice. I've liked parents being involved. We spend Title I money every day to get the parents involved in the kids, but then when they do, you tell them we know best. But my thing is, I don't know if it's a right or wrong or whatever, you know, on the mask or whatever, but I have grandchildren, and you better not tell me to my face that I don't care if something happens to them. And I don't think the mask or what they put up to be, hate the mask, but I told Mr. Tyler, if the majority of the board said wear the mask, which we have a policy. Are we changing the policy tonight with the resolution?
No, we don't have a mask policy.
We have a day-to-day
We have a
operation where he
day-to-day,
can make that decision.
absolutely, that's what we have. We are not.
Okay, so, you know, it's a moot point to even talk about it, because he's made a decision, and I may not agree with it, but whatever the majority of the board is, I don't think the board's even gonna vote on it. They'll do a resolution, whatever. What is a resolution for? You just stand behind it. My grandchildren, if they fall into age, they go to Baldwin County schools, they'll wear the mask if they're the ones that have to wear the mask. So it's done. I've been outvoted I don't know how many times on issues. Well, you just take it and go ahead. And I hope this is the right choice. I want to stay in brick and mortar, because virtual school is not the way to go, in my opinion. And so if it takes the mask, and the majority of the board said it, I may not agree with it, but I'm wearing the mask. And I'm not going to be a problem to the situation. So, you know, I don't know why we even have a resolution. Mr. Tyler had the authority. So be it.
And, you know, it would be whether or not the board wants to vote on the resolution. The resolution only says that we support his decision and that we recognize he has the authority to make it. Anyone else want to add to the discussion or have anything to say?
I would like to. You know, there are, across the state of Alabama, there's over 700,000 students, public school students, in this state. And I don't have an accurate number because I only did a quick search tonight while we were sitting here while I was listening to some of the comments. But just on a quick search, I was able to find 3 Alabama students who have passed away from COVID since all of this began. Now, I'd love to go home. Birmingham, there were 2. Coleman, there was 1 this week. That's 3 too many. And if anything we do as a board or superintendent can protect the life of 1 child, then I will support that as long as I have a seat on this board. And if I have to vote on a resolution to reaffirm the authority that the superintendent has to make these daily decisions, then I will do that too. Thank you. I'm finished.
All right. Well, if there isn't anything else, then does anyone want to make a motion? Does anyone want to not? It's open to the board.
I'll make a motion to support the resolution.
I'll second that.
All right. I have a motion and a second to support the resolution, which supports the fact that we agree that he has the authority given to him not only by this board, but by other statute to make the daily operational decisions of the school system.
Discussion.
All right.
Again, I support Mr. Tyler's ability to take the decision. I believe there's no reason for a resolution, because what is the resolution doing? I'm stating to everyone in this room that I support the decision that he made. But what I don't believe is that you set a precedent. COVID is terrible, but this is just one little hump we're going to have to get over. I don't believe that we should change our policy every time we have controversy. Like I said before, I support Mr. Tyler. I believe the mask should be a parent's choice, but that's only my personal belief. I will support him. If he makes the decision tomorrow, I support the man. But I don't see the need for a resolution. Thank you.
Okay.
Madam Chairman, as I understand it, this resolution does not change policy whatsoever. In my opinion, in reading this, it reaffirms or affirms the board's support of Mr. Tyler in the day-to-day operation. So, I mean, the next thing down the pike, we're not going to vote to change policy unless some policy needs to be changed. This is not changing policy. It's just, I feel Mr. Tyler has been kind of out front, kind of alone, catching most of the flack and the heat, and he's a big guy. I've seen some of the emails about his big boy pants and things like that. He's a big guy. He can handle that. But I think what I'm excited about this is I want to be with him on that. I mean, I don't like controversy. I don't like anybody not liking me. That's a problem I've had all my life. So I ran for school board. That was bright, wasn't it? But I think what this does in my mind is it gives me an opportunity to vote, yes, I support this man in the day-to-day operation and the heck of a job that he's done since this thing began 25 years ago, whenever it was, a long, long time ago. From the last year, we had school. We were in school. Do you know how many systems around the country was not in school? And when we were allowed to have barbecues for the 4th of July, I wonder who was not barbecuing anyway. Anyhow, I'm getting off track. I'm just saying, it does not change policy. What it does, it gives us an opportunity to support the day-to-day operation that he's doing, and he's doing a heck of a job.
All right. At this point, if there's no other discussion, I'll call for a vote. We have a motion and a second on the floor to support the resolution. All those in favor, please say aye. Aye. Any opposed?
No. I abstain.
And the motion carries. So the resolution passes, the motion carries. At this time, as soon as I find my agenda again, I'll see where we are. We are at adjournment, so I'll entertain a motion to adjourn.
Hey, one thing I want to say before that, I appreciate all this information that was brought to us. I mean, it's going to take a while to read this, but I'm thankful that it came to us tonight and was put here, because I assure you it will be read and hopefully understood, but we may have to call and ask a question. I want to thank you for doing that.
All right. I have a motion to adjourn. Need a second?
Second.
Motion and a second to adjourn. All those in favor, say aye. Aye. Meeting is adjourned.